The first test is forward flexion. The person stands with their feet a few inches apart, parallel, knees straight, and you ask the person to bend forward, stop when it hurts, and then return to the starting position. Bend forward, and come on up. Now sometimes the person will bend their knees because they do not want to have any pressure in their back. So she just bent her knees a little bit. So we're going to have you do it again, keeping your knees straight. Go forward, that's it, keep them straight, that's it, and then come back. That's it. Sometimes a person will have pain just standing there. So you need to say, if you have increased pressure or increased pain, stop then, and then come back to the standing position, even if you only bend down 2 inches. The second test is extension. You're having the person stand in the same position, feet a few inches apart, knees straight, and then they bend back. You just ask the person to bend back and stop as soon as there's any pain and come back to the standing position. Bend back for me. And come on back. And if they seem hesitant, you might put your hand in there, small of their back, to make them feel safer, and say, bend again a little farther if you can, as far as you can. That's it. Okay. And again, if they have pain after they bend an inch, they should stop and come right back to the standing position. Another thing the person does is they will bend back, but bend their knees so that they don't actually bend their back. So bend back and bend your knees. Bend your knees. So that means the back is not bending back at all. It's just in the same position, and they're just tilting their knees. So the knees must be straight, even if they bend an inch and it hurts. The next test is side flexion to both the right and left sides. You have the person stand with their feet parallel as they were before, knees straight, and you have them bend to the side. In a normal range of motion, the fingers will reach the side of the knee, and you just see what range they have. So bend to the right, all the way as far as you can, and then bend to the left, and you ask the person to stop if they have any pain and come right back to the starting position. And if they have pain, tell you where they have pain. Now, some people don't have a lot of side flexion, and their body will not bend far enough to stretch the structures you're trying to test. So what you do is you have them bend forward about an inch. Bend forward about an inch, now bend to the side, and they usually get a lot more flexion. And then you have them come up. If that didn't do anything, you have them bend back a little bit, just an inch, and then bend to the side, and bend to the other side. You're noticing their range of motion. You're noticing if they keep their knees straight or bent. Sometimes the person will actually bend their knee as they bend to the side so that they're not actually stretching. It's an automatic response. They're not trying to, not cooperate. It's just they want to protect themselves and not feel pain. The next test is passive flexion of the hip. Here we're checking out the hip joint to make sure that it's really a back problem and not a hip problem. So you place your hand underneath the Achilles tendon. You gently lift the foot, bend the knee. So you're touching the person very gently, and you bring the knee toward the chest. And you press down toward the chest as far as you can, and you give it a little overpressure if there's no pain. A lot of people will only go to here. That's okay. But in a normal hip joint, we'll go to here and give it a little press. Now, sometimes a person gets a pain in the back when they do this. And if that happens, it means you're actually pushing them into flexion. So what you do then is you ask the person to put their fist underneath their lower back. Here, I'll do this side. So let's say I did this, then she said it hurt a little bit. Then I'd ask her to put her fist underneath that side of your low back. And what that does, it prevents the back from going into flexion. Then you do it again, and here you're testing purely the hip joint, and you're not testing the back. And the pain will absolutely just go away. So that test is really for the hip joint to eliminate it so you know you're dealing with a back issue. The next test is passive medial rotation. So you will have just come out of your lateral rotation, so you stay in this angle, and now you're going to put one hand on the outside of the knee, the lateral knee, and the other hand on the inside of the heel, and you're going to rotate the leg like that. Now, a normal range of motion in medial rotation is about there at about 45-50 degrees. Many people will be very limited. Also, when you do this test, it might pull at the sacrum because you're rotating the hip, which has an effect on the sacrum. So you may have to have the person put their hand under their back again to stabilize it so that when you do this test, you know you're purely checking the hip joint and not the back.